Dr. Sutton, thanks for being here. What is fueling this current outbreak, and how much faster is this spreading than prior outbreaks we've seen?
Well, Janae, we passed a significant milestone. The current outbreak in South Carolina is now the largest outbreak of measles in the United States in over 25 years. That surpassed last year's Texas outbreak, and it done so in a shorter period of time, nearly 847 documented cases. And to answer your second question, the reason why we're seeing a rising rate in the number of outbreaks, the size in the outbreaks, and the speed at which they're spreading is strictly because of vaccination rates. We've seen a steady decline in the rate of children vaccinated, down from 95% in the year 2020, closer to 90%. And there are pocket communities like Spartanburg County in South Carolina, near the epicenter of this outbreak, where the vaccination rate in some of these schools is as low as 20%. Wow. So measles is doing what measles does best. It looks for opportunity and it spreads fast.
And I'm glad that you compared it to last year's Texas outbreak, because we remember that comparison. What if a child is too young to get vaccinated? They typically get them at 1 and 5.
They typically get their vaccinations for the MMR, measles, mumps, and rubella vaccine at 1 and 5. We've seen a decline in that. If your child isn't vaccinated, number one, you can talk to your provider, especially if you're thinking about traveling. You want to make sure that you're up to date with your vaccinations as well as your child. That map on the screen was our abcnews.com measles map, where you can type in your zip code or the zip code of your destination to find out the level of risk in where you're going to. As you said, MMR vaccines are typically given as early as the age of 1, but they can be given earlier if your risk is high. For example, in South Carolina, children are getting vaccinated as early as 6 months. So far, at least 600 infants have been vaccinated early due to this increased risk.
Wow, there was a lot of dark blue on that map showing where there is the higher risk. So what happens if you are exposed to
this
measles?
is
what should you
really
do?
important, especially with travel in the airport. So if you, number one, what is an exposure? We typically define an exposure, for example, for the flu as close contact. Measles is so contagious. An exposure is simply being in the same room as someone. And measles can last in the air for up to 2 hours after you leave that room. And if you're unvaccinated, there's a 90% chance that you will get measles, which is why the quarantine of 21 days is recommended. If you're not vaccinated, you want to make sure to talk to your provider if you're exposed in quarantine. If you are vaccinated, you can avoid all of this and continue your life uninterrupted from these preventable diseases. An important reminder of why these vaccines are so important.
But when you say when you're in the same room, so that means on an airplane, potentially,
that means
there's
on an
a lot of
airplane,
exposure.
a crowded train, any small area, measles is going to do what it does best.
If you even know you've been exposed, that's part of the problem, too.
Yep.
Dr. Sutton, thanks so much. We appreciate it.